Okay, so today I'm going to talk about the question arterial blood gases and analysis of some blood samples. And what is this whole question about? It's basically about that you can perform an ABG test, we call it, which is an arterial blood gas test. This test is mainly performed on patients who might have breathing problems or respiratory problems, such as asthma or cystic fibrosis or chronic obstructive pulmonary disease. In this test, we access some different values in the arterial blood. We access the value of bicarbonate, we access the pH level, and we also look at the partial pressure of carbon dioxide. We look at these different levels to detect if the patient might have an acidosis or alkalosis. We can pretty much see that from the pH values of the arterial blood. And then we start looking at the partial pressure of carbon dioxide to see if the patient has an underlying respiratory problem, if the carbon dioxide levels are abnormal, or we can look at the bicarbonate levels to see if the patient might have a metabolic problem, if the bicarbonate levels are abnormal. But I will get more into depth later with that, with the exact values and how we can distinguish between the different types of acidoses and alkaloses, whether they're respiratory or metabolic, or if they're fully compensated by the body or not. So firstly, we have to talk about how do we perform this test, because this is the first step, otherwise we don't have any results. Today I have an imaginary friend, Mr. Anderson, and I will perform the test on him. And we have to use some different equipment. It's a very simple procedure, but we usually take this blood sample from the radial artery in the forearm. It can be taken from other arteries, but usually this is the most accessible one. I have tried this in the summer training last year in Denmark, where I took it from an elder lady in her radial artery. So you use your index fingers to access the pulse in the forearm and to detect, can I feel the radial artery? Afterwards, the doctor will put on gloves and disinfect the area and take out the needle and a syringe, and then just the patient will lay, Mr. Anderson will lay here in a relaxed position with the forearm stretched here, and I will take some blood for him, a blood sample. This blood sample I have to deliver fast to some staff in the hospital. Usually here in Denmark, it's the nurse that takes it fast, and they will put it in this special machine, and this machine will print out a receipt, kind of, with the different values in the blood. For example, the pH levels, the bicarbonate, and the carbon dioxide levels. So after this, we will get a paper. Like, let's imagine this is the receipt that this machine printed out. Now I have written 4 different cases here that we will talk about in a bit. But these 4 different cases are just values for now. So we have to look at these values. And to look at the values, we have to first know what is normal and what is abnormal values. And I will get into depth with that now. Okay, now we're going to fastly discuss what are normal range values for different parameters in the arterial blood. The pH should be between 7.35 to 7.45. Is it below that? Then it is acidic. Is it above that? Then it's alkaline. The partial pressure of CO2, carbon dioxide, it should be between 35 to 45 millimeter mercury. And the bicarbonate, it should be between 22 to 26 millimoles per liter. And lastly, we have the base excess, which should be plus minus 3 to 5. And we have these values, and when we look at the patient's ABG results, we will have to check, is the patient within these values, is it above, is it under, to determine, does he have an acidosis and alkalosis, is it respiratory, is it metabolic, and we also have to look for, is the body compensating the changes, like is it trying to get it back on track, if you can say so. But how do we know if the body is getting back on track? How do we know if it's compensating? We know this by looking at, let's say we have a respiratory acidosis. It means we have a respiratory problem. So this means that we need some metabolic compensation. We need the bicarbonate to either increase or decrease depending on if we have an acidosis or an alkalosis. Because if you have an acidosis, you need more base to compensate. So we would want the bicarbonate to rise, and we would, in an alkaline situation, want the bicarbonate to lower. And the same principle, you can say it goes also with the other type of compensation. So now we're going to take a look at our patients. I have taken 4 different patients today, and the first patient, he has a pH on 7.2, so we can here see he is acidic, so he has an acidosis. His partial pressure of carbon dioxide is 80 millimeter mercury, which is high, so it seems like he has a respiratory problem. So we can say it's a respiratory acidosis. But is this compensated or non-compensated? We look at the bicarbonate. It's 24 millimoles per liter, sorry. So it's not really rising. It's within the normal values, you can say. So it's not compensated. The body is not really doing a great job on compensating it. And we can also see the pH value is still very acidic. So I would say this first patient has a non-compensated respiratory acidosis. Moving on to the next patient, the pH is 7.38. So it is in their normal value, right? But we can see it's on the more on the acidic range, even though it's on the normal value. The partial pressure of carbon dioxide is 25.7, so it is low, right? And we look at the bicarbonate, which is 18.1. So this is quite low, and this means that the person has a metabolic problem, but it seems like it's compensated. So I would say this person have a compensated metabolic acidosis, because he had a problem, but we can see the pH is getting on track, it's in values, so it's a compensated metabolic acidosis. Next on, we have the third patient. He has pH 7.5, so an alkaline pH, and the partial pressure of CO2 is 28.7. So it seems like he has a respiratory problem because it is below values, the normal range of values. And he has not really changed the bicarbonate value. The bicarbonate value for him is 24, so it seems like it's a non-compensated respiratory alkalosis. Also, the pH is not within normal ranges again. So this patient, the third patient, has a non-compensated respiratory alkalosis. Lastly, we have the last patient, pH 7.1. The blood is acidic here. The partial pressure of carbon dioxide is 40 millimeter mercury, which is, not so good for him. And the bicarbonate is 12, so it is very low. It indicates he has a metabolic problem, a metabolic acidosis, and it seems like the body is not compensating here. So we have a non-compensated respiratory acidosis for the first patient, a compensated metabolic acidosis for the second patient. So now we have talked about some different situations for patients that have pathologies, and what could be an underlying reason for these results. It could be different things actually. It could be lung failure, it could be kidney failure, it could be from trauma, from shock, like we mentioned before, chronic obstructive pulmonary disease. It can actually also come from drug overdosing. It can come from diabetes, where they get a ketoacidosis. It could come from chemical poisoning, basically, or metabolic diseases. And also, as I mentioned before, asthma, where you breathe or not breathe, we always breathe, but asthma that makes the breathing irregular. So yeah, there's many different pathologies that can cause these disturbances, acid-base disturbances. And I think there needs more time than 10 minutes to get into depth with these, but I think it's important to understand the acid-base disturbances can be caused from a broad range of pathologies. And this is all I had about this topic.